Did you know your body has a way of sending signals when your blood sugar is too high? If you know what to look for, you can catch it early and take steps to manage it. Understanding these signals can empower you to make informed decisions about your health and well-being. By paying attention to what your body is trying to tell you, you can take proactive steps to manage your blood sugar levels before they become a bigger problem. Number 1. Fatigue. We all get tired now and then, but if you're constantly exhausted even after a good night's sleep, it could be a sign of high blood sugar. When your body doesn't use insulin properly, your cells don't get the energy they need, leaving you feeling drained. This type of fatigue isn't the usual end-of-the-day tiredness. It's a pervasive, lingering exhaustion that makes it hard to get through your daily activities. You might find yourself struggling to stay awake during the day, needing naps, or feeling like you just don't have the energy to do the things you usually enjoy. This happens because, without proper insulin function, glucose stays in your bloodstream instead of entering your cells to be used for energy. Essentially, your cells are starved of energy, even though there's plenty of glucose available. This constant lack of energy can also affect your mood, making you feel irritable or depressed. If you're experiencing this kind of persistent fatigue, it's worth considering whether high blood sugar might be the reason. Number 2. Increased thirst and a dry mouth. This is a classic sign of high blood sugar. When there's too much sugar in your blood, your kidneys have to work overtime to filter and remove the excess glucose. They do this by excreting it in your urine. But here's the catch. Glucose pulls water along with it, which means you end up peeing more than usual. This process is called osmotic diuresis. As your body loses more water through increased urination, you become dehydrated. Dehydration triggers your brain to send out thirst signals, urging you to drink more fluids. So, if you find yourself constantly reaching for a glass of water, even when you haven't been particularly active or it's not hot outside, it could be your body trying to compensate for the fluid loss caused by high blood sugar levels. This excessive thirst, also known as polydipsia, can be quite persistent and doesn't seem to be quenched no matter how much you drink. You might wake up in the middle of the night needing a drink or feel a dry mouth all day long. If this thirst is paired with frequent trips to the bathroom, it's a strong indicator that your blood sugar might be too high. In addition to making you thirsty, this dehydration can lead to other symptoms like dry skin, headaches, and even dizziness. Your body needs a proper balance of fluids to function well, and when that balance is disrupted, you can start to feel the effects in various ways. Staying hydrated is crucial, but if you find yourself drinking a lot more than usual and still feeling thirsty, it's important to consider that it might be linked to your blood sugar levels. If this sounds like what you're experiencing, it's a good idea to get your blood sugar checked to see if it's the underlying cause. Number 3. Blurred vision. High blood sugar can cause the lens of your eye to swell, making it harder to focus. If you suddenly start seeing things a bit blurry, and it's not just because you need new glasses, high blood sugar could be the culprit. When your blood sugar levels are high, it can affect various parts of your body, including your eyes. The lens of your eye is responsible for focusing light onto the retina, allowing you to see clearly. For the lens to function properly, it needs to be perfectly shaped and clear. However, high blood sugar can interfere with this delicate balance. When there's too much glucose in your blood, it can enter the lens of your eye. The lens doesn't have a way to regulate this influx of glucose efficiently. Once inside the lens, the glucose is converted into a substance called sorbitol. Sorbitol is an osmotically active substance, which means it attracts water. As sorbitol accumulates, it causes the lens to swell with water, changing its shape. This swelling alters the curvature of the lens, which affects how light is focused onto the retina at the back of your eye. Instead of a sharp, clear image, the light is scattered or blurred, leading to the perception of blurred vision. This can make it difficult to see objects clearly, read, or perform tasks that require precise vision. You might notice that your vision is particularly blurry when looking at things up close or far away. It's important to take blurred vision seriously, especially if you have other signs of high blood sugar. If you notice that your vision has become blurry and it doesn't seem to improve with a new prescription for glasses or contact lenses, it's a good idea to get your blood sugar levels checked. This symptom can be an early warning sign that your blood sugar levels are out of balance and need attention. Number 4. Hunger. No matter how much you eat, but your hunger doesn't seem to go away. This happens because your body isn't getting the energy it needs from glucose, even though there's plenty of it in your blood. Let's break down why this happens. In a healthy body, insulin is the hormone that helps glucose from the food you eat enter your cells, where it can be used for energy. When you eat, your blood sugar levels rise, and your pancreas releases insulin to help move that glucose into your cells. But when your blood sugar is consistently high, it usually means your body isn't using insulin properly. This condition is known as insulin resistance. With insulin resistance, your cells don't respond effectively to insulin. This means that even though there's plenty of glucose in your bloodstream, your cells can't absorb it properly. Essentially, your cells are starved of energy despite an abundance of fuel. This lack of energy triggers your brain to send out hunger signals, prompting you to eat more in an attempt to get the energy your body needs. This type of hunger is known as polyphagia. It can lead to a frustrating cycle where you eat, your blood sugar levels rise even higher, but your cells still can't access the glucose. So, you continue to feel hungry, leading to more eating. It's like your body is stuck in a loop, always craving more food to satisfy its unmet energy needs. This insatiable hunger can also lead to weight gain, as you consume more calories than your body can use. Over time, this can contribute to further insulin resistance and a higher risk of developing type 2 diabetes. It's a vicious cycle that can be difficult to break without proper management. Managing this type of hunger involves addressing the underlying issue of high blood sugar and insulin resistance. This typically includes lifestyle changes such as adopting a balanced diet low in refined carbohydrates and high in fiber, regular physical activity, and possibly medication to help your body use insulin more effectively. Number 5. Slow healing cuts and bruises. High blood sugar can affect the healing process in several ways. First, it can damage blood vessels over time. Elevated glucose levels can cause the blood vessels to become less flexible and more prone to narrowing and clogging. This impairs circulation, reducing the amount of oxygen and nutrients that reach the wound. Without adequate blood flow, the healing process is slowed down because the affected area doesn't get the necessary elements to repair and regenerate tissue efficiently. Second, high blood sugar levels can impair the function of immune cells. White blood cells are critical in the healing process because they help fight off infections and facilitate tissue repair. However, when blood sugar levels are high, the effectiveness of these cells is compromised. They become less efficient at their job, making it harder for your body to fend off infections that can further delay healing. Infections can take hold more easily and be more severe in people with high blood sugar, leading to longer healing times and more complications. Inflammation also plays a role. Chronic high blood sugar levels can lead to a state of low-grade, persistent inflammation in the body. This constant inflammation can interfere with the normal healing process. Instead of facilitating healing, the inflammatory response becomes maladaptive, hindering the body's ability to repair damaged tissues effectively. Another factor is the effect of high blood sugar on collagen production. Collagen is a protein that is essential for the formation of new tissue and wound healing. High glucose levels can interfere with collagen synthesis, leading to weaker tissue formation and slower wound closure. Moreover, neuropathy, or nerve damage caused by high blood sugar, can also contribute to slow healing. When nerves are damaged, you might not feel a wound or injury as acutely. This means that minor cuts, scrapes, or bruises might go unnoticed for longer, delaying the start of treatment and proper care. By the time you do notice and start addressing the wound, it may already be more severe or infected. If you notice that small cuts, scrapes, or bruises are taking a long time to heal, it's important to consider that this might be linked to high blood sugar. Pay attention to how long it takes for minor injuries to improve. For instance, if a small cut that used to heal in a few days now takes a week or more, This could be a sign that your blood sugar levels are affecting your body's healing processes. Number 6. Tingling or numbness. This condition is often referred to as peripheral neuropathy, which is a type of nerve damage that can occur when blood sugar levels remain high for an extended period. Peripheral neuropathy primarily affects the nerves outside the brain and spinal cord, particularly those in the extremities like your hands and feet. When blood sugar levels are consistently high, it can lead to a process called glycation, where excess glucose in the blood binds to proteins and fats. This process can damage the nerves directly and indirectly by affecting the small blood vessels that supply the nerves. Here's how it works. High blood sugar levels can cause damage to the walls of the small blood vessels, capillaries, that supply the nerves, particularly in your extremities. When these blood vessels are damaged, they can't deliver enough oxygen and nutrients to the nerves, leading to nerve fiber damage and nerve death over time. This lack of proper blood flow is one reason why nerves become damaged and start to malfunction. The symptoms often include tingling sensation, numbness, burning or sharp pain. Managing blood sugar is all about balance. Diet, exercise, and sometimes medication can all play a part. But the first step is recognizing when something might be off. You can also check out my other video that talks about 8 drinks to stop high uric acid. Did you find this video helpful? Please consider liking and subscribing to our channel for additional informative content. We appreciate your support very much.